Welcome to the Animal Control Report with your hosts
Ashley Bishop.
and Daniel Ettinger. How you doing, Bishop?
I'm here. I'm here.
It's if for those of you that are just tuning in, this is your first episode. Bishop and I both recently went under the knife.
We're broken.
We're both broken, so bear with us as we continue to try to bring you some animal control related content, animal shelter related content, just the stuff in that forum. Check out our website, keepithumane.com, keepithumane.com / the, let's try that again, keepithumane.com / wow. This
Animal
is,
control report.
well, no, that too. This is what happens when I'm telling you, I don't sleep anymore. This is tough. Everything's so hard. Uh, I'm trying to promote our podcast network. So keepithumane.com / podcast network. And that way you can see some of the other cool podcasts that are out there with similar, when I say similar, like animal welfare related content. You have the Community Cats podcast, you have the Don't F Up the Crime Scene, animal control related crime scene stuff, and then of course you have the Animal Welfare Junction, which is great as well. So all three of those are super cool.
Yeah.
And
And we've had
really,
all of them on our podcast as well.
we have, and maybe we'll get them back this year. We have a full slate. We're actually, so this is our, I think, 209th episode, season 5, and we're pretty fully booked through. Somebody even booked through September of 2024 to get on the program. So we're booked. We have a full year of podcast for you. We're excited to have you as listeners. Please like, rate, share the podcast. Check us out on Facebook, the Animal Control Report. You can now watch us on Spotify and YouTube, so both have video options. So check that out. And before we go any further, just got a quick read from our sponsor. Tomahawk Live Trap exceeds customers' expectations by providing them with the highest quality, humane animal control products available. Check out their new Pro Series Gravity Door Trap. They feature a door that sets automatically when you open it. No hook or plate setting needed. Use discount code KeepItHumane for 10% off your order at livetrap.com. Again, Keep It Humane for 10% off your order at livetrap.com. Great stuff. Great
I
stuff they
want
have over there.
to, not only do they have great equipment, but the people that work there, we've been to several conferences with Kyle, and let me tell you, like he is all about animal control, like everything that we've ever talked about on the podcast about wanting to be unified and everything, he is all about like advocating for us. So,
Absolutely. Great company, great people.
yeah.
I got an email from Jenny. I'll be shooting you an email back there, Jenny. So thank you for reaching out. She's also with LiveTrap. So again, check it out, livetrap.com. Great people. So today it's the Bishop and Ettinger show again, and we're going to do something a little different. We've had 200 plus programs and we've talked about it a little bit, but we've never truly really dug into the whole euthanasia subject. I'm telling you, these words are not working for me today.
Ever.
We talk about euthanasia in certain aspects, but we've never really talked about euthanasia. And so today I wanted to kind of get into that a little bit, just as like a general overview. Maybe you're somebody that's new to the industry. Maybe you're somebody that doesn't have to euthanize. So I want to talk about all those things and and really just kind of take it forward from there. With you, Bishop, with your vet tech background,
Hmm.
how was euthanasia taught to you?
Um, well, I had a lot of experience with it prior to the vet tech
Okay.
stuff. So I mean, we learned about it in class, but it was a lot more probably dealing with it when we actually did our externship. So we had to do a 3-month externship at the end of our school.
Okay.
And so if you were exposed to it within the vet clinic at that point, that's probably a little bit more where we got into it. But I've also taken the euthanasia certification class.
Through who? Who'd you take that through?
Oh, damn, that was 10 years ago. I don't remember.
Well, let's like I think that's good for our starting point is when you think about it. I can't say this is actually accurate for every agency, but most agencies will have you get certified on the practice of euthanasia through some sort of training. I know when I
Hmm.
started in Denver, actually before Denver. before Denver, I think I took a course called euthanasia by injection, and it may have actually been put on by the HSUS at that time.
Acts.
No, this is
Okay.
14 years ago. I can't recall who put it on, but they follow certain guidelines. And if you are interested, the AVMA, the American Veterinary Medical Act,
Association.
thank you, that AVM, AVMA.org, uh, AVMA.org has euthanasia guidelines. So a lot of training is based off of what the AVMA is going to recommend for euthanasia. So you go through this class, and it's a lot of just academics, right? Understanding, um, I would say like the amount to use. So like measurements versus the weight of the animal, the type of animal, where to euthanize. There's
Mhm.
three places that we typically use injection, and what are those three places, Bishop?
Uh, IV, so
So
through the vein.
intravenous, yep,
Interperitoneal, which is into the cavity of the stomach, not directly in the stomach, but
yeah, the
in
air
that
cavity.
area.
Thank you for
Or
saying that because I was not going to be able to say that correctly.
yeah. And intercardiac, so a direct heart stick.
So those are the three main areas of where you're going to inject an animal with the barbiturate. So we'll get into that here in a second. What kind of drugs are used for that? When we talk about other methods of euthanasia acceptable, what are those? Do you know?
So one of them is with the use of a firearm, as long as it
Correct.
is a single shot kill.
Hmm.
Um, I believe in certain circumstances, um, carbon monoxide is also still
It
allowed to some degree as long as the animal can be sedated prior to.
it is. That's correct. And I don't know if it has to be sedated. We'd have to dig through this guidelines. However, it's 121 pages. So
Oh, I've dug through it. And that's why I want to say they have to have some kind of sedation prior to. Um, I'm trying to think of,
it's those three.
yeah, I was gonna say I don't think that there's really anything because the um decompression chambers were outlawed
And as we talked on the show before, I mean, euthanasia goes back hundreds and hundreds of years. Animal shelters in the 1800s, so just like 150 years ago, in some aspects, even early into the early 1900s, would put dogs in iron cages and soak them, dunk them. Cats too. They would dunk
in
them
the
in
water.
rivers. Yep, rivers, lakes, etc.
Or
So
they'd have a trailer that they'd hook up to the back of a vehicle and have a pipe go from the exhaust into the trailer.
you know, I busted somebody before I left Denver in 2022 that did that with a raccoon. It took the mother raccoon, trapped her, and then hooked the trap. I'm pretty sure he put a bag on the trap, hooked the trap up to his muffler, and killed her, and left the four or five raccoon pups to basically die on their own.
Ugh,
He was charged, and he pled guilty. So
okay.
yeah, yeah. But so when we talk about the methods, but the methods that if you're getting into animal control or you're getting into shelter work, the method that's going to be most common to you is going to be the barbiturate. And so we'll get to that here in a second. Some agencies may use a firearm for wildlife, and even possibly some rural agencies that deal with livestock may have a bolt gun or a firearm that they use in that aspect to put down one of those large animals as well. So when you think about all that kind of stuff, it's just important that you have to know all the things. And so typically the two methods that two out of the three methods you talked about, the we'll refer to them as IC for intercardiac, IP for inter,
Peritoneal.
and then uh,
IV.
IV for intravenous, right? So for intravenous, you technically don't need to sedate. For
Right.
IC, it's actually written into law in California that you have to, unless there's like mitigating circumstances. But to do a heart stick, you do need to sedate prior. And I would think the same with IP, but it's not standard everywhere.
Yeah, it's more ideal to be sedated for IP as well.
And when people think about this, like, whoa, why wouldn't you sedate for an IV? Most of the times when you're doing it, it's an animal that's close to the end stages of life at that point, doing it without any sort of sedation fluid. Um, that's been my experience. Even if it's an animal that's like younger and really good natured, typically you do a some sort of sedation prior. But if it's an older animal, it's lateral, it doesn't stand, etc. I've been a part of many euthanasias that you just do the IV.
I I don't even know that it necessarily has to do with that because I believe that going IV, it actually has a sedation to it.
Like automatically.
Yeah, when it's going across that the brain barrier,
Okay.
the blood-brain barrier, I believe it actually has some sedation versus the intercardiac, you're stopping that muscle, which is stopping the blood flow to the brain. Um, and so it would basically suffocate at that point. But with IV, I believe it actually gives them some sort of a sedation effect.
See, this is why you have the vet tech background. And so let's talk a couple, like, let's just kind of lay out the drugs in the process here. So, first and foremost, I think you'll hear a lot like humane euthanasia is something that's thrown a lot around quite a bit, which is kind of
It
saying the same thing.
redundant.
It is. The more you want to be political, the more you can say it. Like it's a humane euthanasia. Okay, I get that. We we're down with humane, as you can see if you're watching the video. However, it is redundant because it's a good death, right? Euthanasia
Hmm.
is considered from a Greek origin, meaning good death in that aspect. So when you think about that, so typically what happens, and this is just my experience, Bishop, but if there's an animal slated for euthanasia, whether it's behavioral, whether it's medical, typically what you're going to do is go through. This is a shelter setting, so I'm thinking about it more so in that aspect, right? So it's already going to be signed off by supervisors that review the animal, make sure there's no missing contact information for the owner to reclaim, make sure there's no, you know, microchips that haven't been checked, those type of
Hasn't
things.
bit in the last 10 days.
Also hasn't bitten in the last 10 days because of the rabies aspect of it all, right? And so all those things are going to be like taken into account while you're doing it. So there's a lot of paperwork on that end. And then you're going to have a drug log, right? So you're going to find your drugs, you're going to find your drug log, and you're basically going to weigh out the animal. Now the animal may have been weighed, or there may be an approximate weight. With the premix, it's typically, from what I've seen, is a xylazine and ketamine combo, but a lot of places do it differently. What did you use, or what do you use at your agency?
I don't, I'm certified, but I don't do it.
You don't euthanize. Okay.
I have been trying to get the ability to just because of
Emergencies or something.
emergency circumstances.
Yeah.
Um, but yeah, I end up either taking to a vet or, well, if it's a domestic animal, it goes to the vet or the Humane Society.
Okay.
So,
And so then they would do it there if it needs to be
hmm,
done. Well,
yeah,
typically with a premix, it's something of that. It's going to be something, the xylazine ketamine mix or just ketamine alone. I don't think they use xylazine alone on domestic animals. If I'm not mistaken, I've been told xylazine can give this very dizzying kind of effect to the animals, like a prior to them losing somewhat of a consciousness. Um, and so that's something that's like interesting to understand. Like when we do this pre-mix, when we inject them first to make them unconscious, then we have to wait for that to kick in some aspects. You don't have to wait for it to fully kick in if you're doing an IV stick. If you're doing an IP or an IC stick, then you're going to want to wait that to make sure that they're all the way under sedation. And Bishop, tell our listeners, please, what that looks like.
so you're gonna have things that you won't see anymore. If you do like a toe pinch, they're not
Mhm.
gonna pull their toes back. If you touch the inside of their eye, they're not gonna have a blink reflex. Um, or even the little hairs in the ear that make their ear twitch, you won't get those types of reflexes.
And so if you're doing an intercardiac, you're gonna wait for one, like pretty much all or one of those things to really confirm it. You're not like if you pinch between the toes and you get a reaction, you're gonna wait a little longer. And
Hmm.
it's okay to overdose in some aspects. We were always told by our chief veterinarian at the time to, I mean, these drugs are pretty cheap, just OD,
Hmm.
right? And so we would do that. And then that process can take a good anywhere between 3 to 10 minutes, depending on the animal, I would say, to get it fully under, right? And so when you do the premix, the ketamine xylazine, it typically burns. So when you inject the animal with that, as much as we want to make it as humane as possible and bring apart a just an environment that is like good for them, it's still hard because like you have to restrain them in some way because you're hitting
Hmm.
them with a shot that's going to burn, right? So they're going to react. In all the years that I've had to euthanize, which is several, thankfully I never had a dog come back at me, but I've heard many stories where they have, because of that premix solution, that being restrained, getting shot with that solution, and then um, reacting, and then you have to do things a little bit different. So you get them with that, you let that stuff settle in. And so for me, my process would have been, and shout out to actually one of the old supervisors I used to work with. He kind of taught me, and he didn't intentionally teach me. He just, I was euthanizing with him one day, and after he gave the shot, he would always take the dog outside on a quick walk, not too far because he didn't want to have to try to carry it in. Because as you know, once you hit, once the drugs start to take effect, that animal gets you know, it goes down pretty fast, right?
Yep.
So he would always take them out. That's something that I think is really just, it's nice of them to not remember their last thought necessarily being a sterile environment with bright lights. No, I may be humanizing that a little bit, but
I guess I would personally have a few concerns with that. The event that you're exposing them to a potential oops of, okay, did another animal run up to them or something? And so now what happened? Oh, we have a bite case now?
it was a pretty controlled area though.
Okay.
Yeah, I see what you're saying, but it wasn't like another animal could come unless it was like a squirrel or a bird.
Okay.
Yeah.
Although they do say that the medications tend to work better in a quiet, calm, dark environment.
Yeah, I believe that. I believe that because the heart rate's lower and stuff.
Yep.
So then once they're down, you would typically with the intravenous, on dogs and cats too. It's typically done on one of the front legs. What you do is you have somebody hold. Again, the animal is asleep, so there's not going to be a big concern of them like waking up and reacting. But you have them kind of create a tourniquet with their thumb in the way that they hold and twist, and that way the vein gets exposed. A lot of people, and I recommend it especially early on, or if you're dealing with a thick coated animal, is to shave the area on where the vein is, and then
Hmm.
we hit it with an alcohol to help make it pop out a little bit more, the rubbing alcohol, and then you put the needle in, and if you're good, well, first I should say this: when you draw your euthanasia solution, so we talked already about the premix, right? Ketamine
Hmm.
xylazine. Typically, your euthanasia solution is a, a brand called Euthazol or a brand called Fatal Plus. Those are the
Hmm.
two that I know of. Fatal Plus seems to be the fan favorite. I hate to use those words, but Euthazol takes longer, takes more. It's just not as easy to use. And so Fatal Plus is sodium pentobarbital. And what that does is it, like, what's it do, Bishop? Doesn't it go into your heart and like basically like essentially clogs all the heart with like, it like makes the blood really thick. So it
That
stops.
I don't remember.
Okay. So it stops flowing, right? So it's like just creates almost like concrete in your blood in the animal. then passes away. Um, but when you do this, so when you're putting the IV in, when you draw your solution, if it's a 50-pound dog, you typically do about 5 or 6 cc's, or millimeters, milligram.
Milliliters.
That's it, milliliters. I use the word cc, milliliters. When you put it in and get the solution, you're going to get a new needle. A lot of times you do that just because the needle stays, it loses, it gets dull when it goes in that rubber thing,
A lot of people are using IVs now. They just place an IV and do it.
like a catheter, an IV
Hmm.
catheter.
Yeah.
That's
Sorry.
pretty.
Yeah. IV catheter.
That's cool. So once you get, it's not easy. I'll tell you what. Hitting that vein the first couple times can be difficult, but once you start to get the hang of it, you're like, okay, I can do this. And so, basically, when you get in there, you're going to have the eye of the needle facing upwards. So if you think about a needle, it has like almost like a,
It's
if you,
beveled.
yeah, thank you. It's beveled. And so the bevel part, the eye, is going to face up. So when you go into the, hmm?
I was going to say it, the way it was always described in class is sure the eye of it, but if you just take the longest part of the end and
Yeah,
always have it even with the leg, or well, you're going to either do it leg or jugular. Doubt you're going to do jugular for this, but you keep it even the long part with the leg so that the point goes in first.
yep, exactly. So when you get the point in there, if you're good, you're going to get a flash. So you're going to see that red blood kind of hit the front of the syringe, like right, kind of start to fill it up. The holder's going to let go. Hopefully, the holder's experienced. If not, you're going to tell them, hey, let release. And then you're going to slowly start to inject that fluid. Now, sometimes the vein can blow when you're doing that.
Mm-hmm.
Do you know what causes that? I don't know. Too much air? I don't
No,
know.
not just too much fluid at once.
Okay.
And I mean, veins have various strengths in different areas.
So if the vein starts to blow, you'll see it under the skin. It'll start to ball
Yeah.
up right there, and then you have to stop, pull out, and go above that area, to re-hit the vein, and hopefully you don't. So when you start, you never want to go too high to like the, when you're doing the front leg, you never want to go too high to like the pit of the animal. That way, if you do blow a vein, you have at least probably two more attempts after that in that same region before going to the next leg. Typically, typically you don't have to do that, but there are times where it does happen. Thankfully, more or less than not. I don't. Is that the right way to say it? It happens less than not.
Well, and it's hard too because if you're going to be euthanizing an older animal, their veins are a lot more fragile. If
Hmm.
you have an animal that is dehydrated in any way, it's harder to see the veins. Um, and superstition here, but whatever you do, don't ever look at the animal and go, "Oh, I can see it. This will be easy," because you will never hit it.
It's not easy, and we haven't talked about. I kind of wanted to get into the psyche of it, but I wanted to be practical first. Like this is a medical operation, right? Or a
Hmm.
medical, maybe I wouldn't say operation, but a medical event
Procedure.
procedure. Yeah, a medical procedure. And so it's rare that people do this. Like this is a very rare thing. Now, in our profession, it's not rare, but outside of our profession, outside of slaughterhouses and outside of animals that are part of medical, what do you call that? Like they use them for, like medical testing and stuff like that. Like like not many people,
Labs.
yeah, not many people are paid to euthanize, to kill another thing, which is, it's tough. But we'll get into that here in a second. So, uh, you get your needle in, you pull back, not all the way, but you pull back just a tiny, tiny bit to see, are you in the vein? Did you go through the vein? Sometimes you can pull back on the needle just a little bit. Typically, you only need one hand. Syringes in your dominant hand usually, while you're holding the leg. Pull back with that same hand usually, and then push in, and then once all the solution's in there, IV, usually within the first 60 seconds, if you use the right amount of solution, that animal is all the way out or all the way dead, I should say. And you can listen with a stethoscope. You just put that on, listen to the heart, and once you get confirmation of death, right, you have to then dispose of the animal properly, however your agency does it.
I know a lot of places, not so much vet clinics, but shelters and that would even still take, even if they did it IV, which is usually a little bit easier on the animal.
Sure.
And honestly, psychologically, a little bit easier on the
The
people
person.
doing it,
Yeah.
compared to intercardiac. Um, but I know a lot of places that'll actually, even after IV, they'll do a IC stick just to make sure, because you'll be able to see
Yeah, the
the
needle,
syringe.
the syringe will move back and forth with the heartbeat. So that's the way
Hmm.
I was actually taught. The we when I got into the industry and started to do euthanasia, we had a lot of feral cats that we would euthanize every
Mm-hmm.
morning. We weren't doing TNR, and so we would sedate, and then, gosh, that was just med medlum. No, that's not a word.
Bedlam,
Mayhem.
that too.
Feral cats, like trying to get them and then sedate them. That was rough. Anyway, so then once they were sedated, we would line them up and then do the heart sticks. So you once you like it's the same idea or method. You locate the heart typically using your pointer finger or your thumb. That's how I would locate it, just feeling on the chest cavity. You can even move their elbow.
Use their left front leg, bring it back to the chest, and
Yeah.
usually where the elbow is, that should be right about where the heart is in the opening in the between the ribs.
Yeah, and they're laying on their right side, so good point
Right.
bringing that up too. And then once you locate it, you same kind of concept. You stick the needle in, draw back just a little bit. You want to make sure there's blood. Now, there's a difference between like really dark red and bright red blood,
Hmm.
depending on what cavity you're in inside the heart. I don't know the specifics. I just know that I was able to pull back, confirm there was a heartbeat, and then you would leave the needle, like you would inject it, but you leave the needle and syringe in the heart, and you just watch it, and it just
Hmm.
tips like a heartbeat. Like if you can imagine a syringe moving at a heartbeat's pace, and then eventually it just stops, right? And then you
Yep.
know that the animal is deceased. And then IP, when you do that, when you inject in the stomach region area, kind of with a somewhat of an upward motion with the IV, you pull back and you get a vacuum. You don't want to get any sort of solution or fluid in that. So that's an empty one, and then you just inject. IP, you have to use 3 times as much, if I'm not mistaken.
Yep.
3 times as
And
much.
a lot of times you're using that on more like something like your neonates and
Wildlife.
rats and mice,
Yeah, yeah,
um, things like that you're not going to be able to get an IV or IC stick.
yeah, yeah. Absolutely. So that's kind of just like the general process of euthanasia from an animal shelter setting. The whys behind it, I've never, excuse me, I've never, to my knowledge, have been part of euthanasia because time or space. It was mostly, or if not all, behavior and medical.
Mm. I've been
Uh,
involved with time and space. Well, not time, space.
okay, that's not easy, huh?
No. And there was also medical. This was long before, I mean, we're talking 15, almost 20 years ago. Um, we had a ringworm outbreak,
Okay,
and it was shelter wide.
okay,
And so it got to like we couldn't lime dip everybody or anything. So we went through and woods lamped everybody. And if they had anything that glowed,
that they were,
we went from, there was over 100 cats, probably 30, 40 dogs, down to 15 cats and a couple of dogs.
wow,
Um, and then 11 months later, We had the Khaleesi virus go through
Ugh,
our cat population.
same thing.
Same thing. Everybody got euthanized.
So let's, I think, transition into that aspect of it, like the more the emotional effects that it has on our profession or the people in our profession, and just the effects in general when it comes down to like, where we are societal, and where we are personally and morally. Like I have no objections to euthanasia in the aspects of like public health and public safety, right? I think, the aspects of wildlife, unless that animal's truly suffering or shows like some sort of disease, kind of just my personal thought process on that is like just leave it where it is if you can.
Circle of life and let wildlife be.
Yeah, because I mean, ultimately that's dinner for something else out
Mm-hmm.
there. So for us picking it up because somebody's like, "Oh, this bird can't fly." Well, I know, but if it's truly not suffering and it can hop around and still get to its own shade and food sources and things like that, maybe it's okay that we allow nature to take its course, because without us, it would happen anyway. But
Right.
when you get to you know, the animal that you impounded for an animal cruelty case, however, it just can't pass behavioral evaluations, it's tough to have to put that animal down.
Um, I have one that I can't talk too much about the case yet. It's still open. In particular, the person pled not guilty. So it's going to go further. But when it had nothing to do with behavioral, but it was in the best interest of the animal
Sure.
to be euthanized. I I was given the opportunity by the shelter who had care of the animal. They're like, "Hey, we're going to do this today. This animal is suffering. We're going to do this today. Do you want to be there?" And I said yes. And Dan, I sobbed like a baby.
Yeah.
Like, and I'm not that person. I don't have every once in a while there's just that one animal that just hits different.
Sure.
And like if if anybody was at Taka, um I talked about that there, and I even started crying during my presentation because it still hits different, and we're, several months later.
It's not the easiest thing, and I think that comes down to our own personal views of death, right? And I respect everybody's viewpoint. I'd be remiss if I didn't talk about my own, you know, challenges, or just stories about, like, there was a couple dogs. There was this really fat, super fat, like he was a body condition score like 9. He
Ugh.
was a pity, like blue pity, kind of looked like just a big old hippopotamus. Dog was great with people, excellent with people, but he didn't pass the behavior eval, because he was bad with other dogs. And so I just remember being real sad about that one.
Hmm.
And I remember like kind of following the process to know when his euthanasia date was going to be, and I went and grabbed him a hamburger from McDonald's, and some French fries, and just let that dude have it. I was like, "Here you go,
Hmm.
big fella," and like it's it's the last, what do you say, like like a nice last act, if you will, towards that
Hmm.
animal prior to ending its life, because we really don't know what happens after death. Like, it's subjective. People can have their own thoughts, whether it's religious based, whether it's spiritually based, whether it's the unknown, maybe it's nothing. The reality is just they're not in this consciousness anymore. So I I'll share a story. Back in 2016, which is what now? What year is this? 8 years ago.
Hmm.
It was actually 2015. It was the winter of 15. So 9 years ago almost. My dog, his name was Dirt Dog. And for those of you watching on YouTube or Spotify, that's a photo of
Look at that
him.
smile.
Great dog. That's actually, this photo is taken moments before the euthanasia. And I just remember it was a behavioral call, and he was about 11 years old, and he started to kind of decline physically, but also mentally. I was managing a shelter. I had two young girls at the time. We had a lot of kids over the house, and he was unpredictable with behavior. And one night, just randomly, he went after our cat. Thankfully, he didn't cause any like true damage, but it was just so it was almost extreme and uncharacteristic of him. And so I just remember like really struggling with it that night. Like, um what should I do? What is the next step in this process? Do I like figure out a way to keep him away from the kids? Like, is it responsible of me to like leave him at home, bring him to work, like where there are other animals and he's not friendly? Like, what do I do? He and I went out on a long walk, and I realized like the right thing to do, the only thing to do was to put him down. And I remember I took him to work with me that morning. I was working at a shelter in Eagle County. Uh, Shout out to Vale and all those places up there. I just remember bringing him to work, and the girls and my ex-wife came by, and I think they brought him. No, we grabbed him some canned cat food out of the shelter and just had him in the yard outside, and we said our goodbyes. I had to sedate him because there was no way I was doing it any other way. And so we sedated him outside. And, the girls, they were pretty young. I mean, 8 years ago now, almost 9 years ago now, or whatever. They're like 5, 4, and 2. So they don't really remember. I actually asked my 2-year old if she remembers him at all, and she doesn't. And so I remember just bawling my eyes out during and after euthanizing him. And I, I did everything. I, got his body ready for cremation, and I can't make this stuff up. And those of you that know me have seen the picture before. If you want to see the picture, you can email the show, daniel@keepithumane.com. I go back. We were short staffed that day, so I go back to clean the shelter, and I go outside and I look up, and there's a dog shaped cloud. Like
Mm.
not even like somewhat subjective dog shaped cloud. It's like a dog shaped cloud. It was unreal within minutes after his passing. And so that's definitely one of the hardest things I've ever had to do. I know most people probably wouldn't euthanize their own animal. I just felt like with his behavior and kind of where we were in life, it was the most appropriate thing to do. So that one was tough, very tough.
Yeah, and I mean, our own animals, even for those of us that do it, our own animals still hit differently. I mean, you have that connection. So eh, nobody should ever feel like they are euthanizing animals and they're just either a monster or a feelingless entity. Like, you are likely euthanizing these animals because you either feel bad for them or you're concerned about them in one way or another, whether your concern is for their well-being or what they potentially can do. Like, don't let anybody sit there and say that you don't have feelings. Like, how many times do we get called cold-hearted? Oh, you just euthanize everything.
All the
Like,
time.
that is absolutely the exact opposite of anybody that I've ever known to euthanize an animal, whether it's their own or somebody else's.
Yeah, I've never, I shouldn't say heard, I've never worked with anybody that was like, hey, can I do all the euthanasias? Like, I want to be the
Yeah.
euthanasia technician. Now, some agencies may have just euthanasia technicians, but I've never heard of like anybody in that aspect. I will tell you that regardless, whether it's your own animal or other animals, like it's it's a task that we as humans have made necessary for multiple reasons, right? It's just where we are societal, and I know that there are hopes that we never have to do that again. I think as I talk about access to care and getting resources in communities, until we can really tackle that, euthanasia is always going to be part of the profession that we're in, and it probably always will in some aspects when you think about just one health, right? Like public safety, public health, that type of stuff. Really having that connection there when you think about it. So like it needs to be done. It needs to be done respectfully. I can tell you. So I never was part of this, but just years before I started in Denver, the officers would just do IC sticks without any sedation, and typically what they would do is just put the dog on a leash, like a leash rope, not even like a collar, and just like someone would pick the dog up by like almost choking it, right? Like by its neck with the leash on
Ugh.
it, and just inject the solution right into the heart while the dog was alive, like, or not even just alive, but while it was like awake in that aspect. So that's like the definition of not being humane at all,
Right.
right? Like having like this almost assembly line, if you will, of just killing, right? Just like picking them up with their choke chain, or it's not a choke chain, but similar, and then sticking them in the heart. So I think we've come a long way when it comes down to euthanasia, that necessary evil, if you will, whatever you want to call it. I don't think it's evil. I think it's a
Mm-mm.
necessary side effect or a necessary part of the job, because we just have so much that we're incapable of helping with. There's not enough staff, there's not enough resources, and there's
I
animals
mean,
that are
even if you just look at end of life stuff too, like we're never gonna get away from,
like an animal that's 14 and it's time to go or whatever.
yeah,
That,
a
yeah,
Great Dane that's 14 and
yeah,
I've
yeah,
seen it.
yeah, yeah. Well,
But
I mean, that's the thing, is we know that it's a necessary part of this profession. I think that's one of the reasons why we wanted to talk about it today. And hopefully it answers some questions, especially if you're like new in the profession, kind of what does that look like? How does that work? And, just the process itself. It's, I'm sure some people remember every single animal they've euthanized. I
I
can't.
couldn't.
Yeah, I couldn't. I just know
I
I can say, I'll say this though. I can remember that each one that I go into, regardless of the animal's behavior, temperament, condition, etc., I treat it all the same. Like it's business.
mhm.
Yeah. I try to remove any emotion from it.
I don't wanna say that I try to remove emotion. Again, I don't at this point in time do the euthanasias. Um, However, I'm involved still to some degree with, holding or whatever, in a lot of them. The compassion,
Yeah, that's a good word.
showing the animal the compassion, that's every one of them
I
has
often will
gotten.
sit on the floor with them, um, especially if they're not like super behavior risks,
Mhm.
right? But I'll often like we'll have a towel on the floor ready for them,
Yep,
especially if they're bigger, so they don't like just flap down, and then just slowly, pet them, make them
yep,
feel as comfortable as you can. Absolutely.
yeah. Talk to them quietly possibly, and
Offer them treats if they're hungry, if they want one,
yep.
that kind of stuff. Well,
One thing that I definitely do at this point is every dog gets some kind of chocolate,
oh,
like a little Hershey's kiss to, you know, no dog should ever die without ever tasting chocolate.
there you go.
So,
Did you watch that movie Strays? Speaking of, let's end this on a positive note. It's a movie. It's about stray
no, I
dogs.
wanted to see it. I
Well, this
haven't
won't
seen it
this
yet.
won't ruin anything, but they think chocolate is their poop, because we always pick it up and put it in
Nice.
bags, and then we put it in bags. That
That's
movie's
funny.
that movie's cute. I mean, obviously there's like a little dog catcher element of it. Whatever. We're never going to get rid of that. However, it was cute. So, well, with that, like this isn't like the most fun episode in the world, but I'll tell you, it's a conversation that needs to happen. I can guarantee you there's really no content out here that talks about the process the way that we did, and I think it was
Mm.
important for us just to cover it.
Yeah, I agree.
If you have any
And I mean,
questions, yeah,
worst case scenario, if it's not somebody's cup of tea, they could have
don't
shut
listen
it
to it.
off already and
Yeah,
moved on to the next episode.
they don't have to listen to it. So, but if you have questions about the process, if you want any of those links, as I mentioned, avma.org has a whole euthanasia guideline. There's some other guidelines out there. There's not just one. There's a lot of not testing, certification available too.
Hmm.
We can forward you along that stuff as well if you
A
need it.
lot of times with those certifications, you do not get the opportunity to um,
To
have a
actually
practical.
participate.
I know Humane Educators of Texas does provide that, which I think, as hard as that is, I think is actually fantastic.
Oh, it's
Um,
necessary. There's no question
yeah,
about it. Yeah.
I think everybody, if you're going to take the class, you should have that so that you don't get to a point where you're seen as, oh, you're trained, so now you got to be by yourself or, with other people that are, I don't want to say uneducated, but without experience and then get put in a situation where, you're struggling with an animal. So if you can find a training that you have the opportunity for a practical, I would go that route.
Yeah, and check out Humane Educators of Texas. They do some great training, and they work with some local shelters that, again, they're making decisions based off of behavior, based off of health. They're not just going to grab some random animal, but it just looks
Right.
like there's a reason behind it. So, whew, that was a tough one, but it was a good one. It's one that we
Yeah.
definitely needed to have. So, thanks for all your input on it too.
Yeah.
And join us next week. We'll have somebody on. I don't know. I promise it won't just be Bishop and I all
Even if you
2024.
just say their name, they may not be them because our episodes get mixed up.
Oh,
So,
good point. Good point. Good point. Well, we appreciate you listening. Please check out our website, keepithumane.com. Check out the podcast network, keepithumane.com/podcast network. Also, check out our sponsor. That's livetrap.com, Tomahawk Live Traps, livetrap.com. Use Keep It Humane for 10% off your next order. And as always, we like to say thanks for listening and
helping people
people help animals.
help animals. You were going to say the
Yay!
other one.
Keep it humane. I'm always going to say the other one.